I wanted to ask a little bit about some of the research that you've been doing pertaining to the Middle East, North Africa region, and when it comes to um, refugees and migration patterns, and how all that impacts people's health. Just to give also give us an idea of like an overview of what your research about that is.
Sure. So I am faculty in the program on forced migration and health at Columbia's Mailman School. And that program was originally founded after Rwanda and really is known for training sort of the next generation of humanitarian sort of aid workers. And so as a result of that, very active in refugee communities throughout the world and drawing attention to issues of forced migration and health and refugee health. And so it's both like an honor and privilege to be a part of that program because even before coming to Columbia, I was focused on Syrian refugee health, given that the crisis has gone on for well over a decade now. So my work in the region originally focused on extension of sexual and reproductive health services to refugee women and girls. I would say it's evolved to a lot more than that because, for example, they've been in Jordan in a protracted crisis kind of situation now for a number of years. It's gone beyond sort of emergency response and getting people sort of their immediate healthcare needs and into a like long-term and protracted response effort. And so I look at things that range from, engagement in education, or like how are Syrian children being provided education and what are the implications of that for their health and well-being. And I look at things like what are the decision-making sort of determinants for people to continue migration onto Europe? Like what prevents them from doing that? I've looked at the employment sector, for example. But I come at these things looking at them in the way that they intersect with health. So yeah, it's a whole range of research projects in the region, a lot, mostly on the refugee experience in both Lebanon and Jordan.
Yeah, I mean, there's so much that could be done with that. That's such a huge, like, broad, just a field, really. It's almost like a field of its own, it seems like. One of the things that I've always been curious about, and we've talked about this before, but I saw with my own eyes in a Lebanese refugee camp. It was, Syrians who were at this refugee camp in Lebanon, was the amount of kids that the refugees were having, right? And one of the things that was being talked about a great deal was, well, they're in this really difficult situation. Why are they having so many kids? And they were talking about, well, there were activists who were trying to reach out, and I don't know if it was the UN who were trying to educate or inform the refugees about like birth control methods and all that. So being a host population dealing with very few resources, and obviously it's a political issue when you have millions of people, like refugees in your country. But at the same time, and this is something I also read from what you like, one of the things that you had written or was interviewed about was that a lot of the refugees in those environments are coming from areas in Syria where they have high fertility rates. So,
yeah, this is one of my pet peeves. So the narrative is often that refugees come in and have a lot of children, and the same narrative has been applied to the Syrian refugee case, but it's actually like a data anomaly. Like if you look at what the fertility rates were before migration, it can give you greater insights into like migration is not triggering higher fertility. There was actually like a pre-migration fertility rate that was elevated amongst a lot of the communities that refugees originated from. So actually, if you look at the fertility distribution in Syria before, you see that they're coming from high fertility areas. So I actually think the impact is quite a bit less than people make it out to be. That said, there's quite a bit of literature also on the impact of disasters like hurricanes and earthquakes on fertility rates, and they are often elevated in response to disaster.
So I think, yeah, Hussein said that we should like, maybe stop so that we could start a new recording so that it
Sure.
We have a
works
time,
better
we
with
have
the
a time
editing.
limit on what we can do with 3 people on Zoom, so.
Okay.
So let me end this and I'll send the link out. I'll just email you the link, Olene.
Perfect.
All right.
See you
Thanks.
soon.